Welcome to week 2 of Women's Wellness Wednesdays. This Golden Valley Health Center's project is funded in partnership with EMC Health Foundation. Remember, you can win a great women's wellness swag bag by sharing this content and tagging a woman you care about. Welcome to your 30s. Let's talk about how to help you live your healthiest life. The information provided in these slides is adapted from the Department of Health and Human Services Office on Women's Health. Not all of the information may apply to your life. Golden Valley Health Center's providers are available to help you get personalized health care. Call or text us at 866-682-4842 to schedule an appointment today. Let's talk about things that you can do each day to keep yourself healthy. You can choose to focus on one thing each day or work toward doing all of these steps. Eat healthy foods. Use the MyPlate plan to get started. You can go to choosemyplate.gov for more information. Get at least 30 minutes of physical activity each day and at least 7 to 9 hours of sleep each night. Reach and maintain a healthy weight. Get help to quit smoking or not start smoking. Limit alcohol use to 1 drink or less, and don't use illegal drugs or misuse prescription drugs. Take 400 to 800 micrograms of folic acid. Wear a helmet when riding a bike and wear protective gear for sports. Wear a seatbelt in cars and don't text and drive. There's also a lot you can do to stay sexually healthy at any age. Limiting the number of sexual partners and using a condom each time they have sex are 2 great ways people help protect their sexual health. Let's talk about information that may be important for you to talk about with your provider at your next Well Woman visit. A Well Woman visit is a yearly preventive checkup. It's a time to check in on how you're doing, how you'd like to be doing, and what changes you can make to reach your health goals. Examples include whether you plan to get pregnant in the next year, or to talk about the birth control method that's right for you. Talk about your weight, diet, and physical activity level. Talk about whether you use tobacco, alcohol, or drugs. Talk about any violence in your life. And talk about depression or any other mental concerns that you may have. Also, talk about protecting yourself from the sun and the hazards of tanning. Talk about your family health history, especially any history of cancer, heart disease, and diabetes. And finally, talk about your unique story. Let your provider know what makes you, you. At your next Well Woman visit, your provider may recommend the following tests, medications, or vaccines for you. The decision to get any medical test or procedure at any age is a personal one between you and your doctor. These recommendations may not apply to every person. Your doctor may recommend that you have your blood pressure checked, have a PAP and HPV test. It's also recommended that everyone have at least 1 HIV test during their life. You also may need to be tested for sexually transmitted diseases, and you may also need a tuberculosis test. Your doctor may recommend that you take folic acid, and if you have any chronic conditions, your provider may recommend certain medications to help you manage it. You may also be due for several vaccines such as flu, chickenpox, hepatitis A and B, HPV, measles, mumps and rubella, meningitis, tetanus, diphtheria, and whooping cough. If you're pregnant, prenatal care can also be a Well Woman visit. There are also certain tests during pregnancy that your provider may recommend to check you and your baby's health. Check out our other videos this week for women of all ages. Remember, you can win a great women's wellness swag bag by sharing this content and tagging a woman you care about. Schedule your appointment today by calling or texting 866-682-4842, and thanks again to our partners at EMC Health Foundation.